In Look Good, Feel Good, we welcome back Nicole Bell from Face Today Medi Clinic, and she's joined by Chris Jones, who of course we've been following Chris's journey, her makeover journey without surgery, and we're going to come to Chris shortly. But we have Marty Weaver. Marty's our production supervisor. He's also our floor manager sometimes. And when you were on a couple of weeks ago, honestly, we went into meltdown on our website with people wanting to know about nose jobs without surgery. So we thought we'd give Marty a go. Now, you've had a little bump on your nose that you've bothered you. Has it bothered you, Marty?
It hasn't bothered me, but I've always known it's there and it's noticeable, so I wouldn't mind getting rid of it.
All right, and you're going to do it on camera.
Well, I'm just going to do a little quick tweak and he'll be gorgeous on.
All right.
So you happy?
Yeah, we're very happy now. Of course, it does mean that it is going to be an injection. So if you don't like looking at needles going in, then what I suggest you do is just kind of chat amongst yourselves at home. But what Nikki's doing is you've actually already deadened that area, haven't you?
Yes, I've had local anaesthetic cream on for some time so that it was nice and numb. So as you can see, Marty's just sitting there looking very, very happy. Yep. And it really doesn't hurt very much at all. So basically what I'm doing is just elevating from where he has the bump. I'm just elevating the tissue, and it's amazing when you actually elevate it, how it actually turns a nose that has a bit of a bump into what looks like a straighter, smaller nose.
Just
you can start now.
Okay, we're actually, believe it or not, you can stop bleeding on my artwork. Whenever I'm doing this, I say to patients, okay, that's enough. So we're actually nearly done for this area. There's other little bits and pieces that I could do on Marty. I'll just put pressure there for a second. But in actual fact, he has a slightly dipped nose here. Just hold that for me. And what I could do is actually just put a little tip in there and just pick that nose up. He's got a little bit of a dip in here, and if I had him in the practice, then I would actually do both of those areas as well. But I thought we'd just do a quick little demo on the bump, and that would be enough. Well,
while you're applying pressure there, let's talk about Chris just while you're finishing off Marty, because you've also tweaked Chris's nose as well, haven't you?
Yeah, so before we got on the show today, what I did is I decided I'd just straighten Chris's nose very slightly. She had a very small little bit of a bump here, and also a little bit of an indentation on both sides, and a little bit of a dip here. So I've just done a general little bit of elevation. Now her nose is straighter and also not sort of undulated on the side.
How fantastic.
Straight again.
It's straight again, which is lovely.
It's actually a very emotional thing, Susie. When people come in, they just don't want to have profile shots. It changes their life. Okay, we'll have he's doing a little bit of an ooze, but that's cool. But we could probably get a sideways shot, Susie, if you'd like to.
Yes.
So you want to look at me, Marty? So that's just pick the nose up. It's not totally perfect, but I could do a bit more of a play. But just for the idea of the camera, you can see it's actually straightened his nose.
That's just incredible. Incredible.
It has.
In fact, I don't know if we can call for that before shot again, just so we can have. There you go. Look at that, and you can see it was. No offence, Marty, but it's a little bit of a peak beak there.
It does actually take
so slightly.
Yeah, absolutely. It takes the look of the beak nose away, and it actually turns it into quite a regal Roman nose, which is really a good look.
It certainly is. Now, obviously, the nose is an area that bleeds a lot, is it, when you do that?
It is very vascular. But the good thing is, as you can see by the look on Marty's face, he wasn't actually wincing and feeling like he was, in a lot of pain. So it's quite an easy thing to do.
So how do you feel, Marty?
Like a beer. I've got a good view. I'm happy.
That's what caused the dent.
Have a little look. Just give yourself a little look on the side.
How do you do that? Oh, yeah, cool.
It's made a difference, Marty.
Unbelievable.
Incredible indeed.
So it's really good, Susie, for people who've had skin cancers, accidents, any sort of deviation on the nose. Rather than have to have a whole rhinoplasty, you can just have a little tweak. But again, it's a specialist job.
Because your downtime is just almost nil, isn't it?
That's right. You can walk in, and actually I do so many noses every day because most people that walk in to have something done at Face Today Medi Clinic have a crooked nose. And I say, do you want me to straighten your nose while I'm there? They say, you're joking, can you? So, absolutely.
So how long, first of all, what have you put in it?
The product I put in today is called Radius, and it's a product that will last for about 2 years. But if someone's not sure if they're going to like the shape of the nose, I'll start off with a hyaluronic acid, which is a product that generally goes in lips and lines, but it lasts for about 6 months to 12 months. So they can have a little play and make sure they're happy, and then come back and I can put a more permanent product like Radius in.
it's quite remarkable, isn't it, what you can do?
Actually, I think it's one of the most emotional things that I've ever done, Susie, in that when people come in and they've been so upset about their profile, never wanting to have a photo taken from the side, and as soon as you straighten the nose, a lot of them burst into tears because they're just so thrilled, but just a little bit of a tweak. But as I said, there is a little bit more tweaking to do. I would actually if I just put some elevation here, it would pick Marty's nose tip up, and I could just do a little bit of, but I'm going to do that off camera afterwards.
All right, and then we will certainly have a look at him the next time you come back,
Absolutely.
which is fabulous. Thank you, Marty. You
Pleasure.
stay there for a moment.
Yep.
We'll admire your nose.
I'm off to the nightclub tonight.
Are you just? I see. At Broker's Nose?
I live just under it, actually.
Do you? Now, with Chris, what have you done with Chris so far?
Well, we've actually done a lot of dermal filling with Chris, and we're going to start onto a new exciting journey, which is going to be a lot of skin work with her. So we've done some botulism toxin, which of course everybody knows is Botox. We've done lips, we've done some elevating through the cheeks, and now we've started doing intense pulse light and some other work, microdermabrasion. We're looking at skincare products, so we're really aiming for Chris's skin to be really changed, smoothed and rejuvenated.
Now, we're looking at a before shot of Chris, and there's no doubt about it, you've wiped at least 10 years off her
Absolutely.
age already, and look at the difference there. In fact, I'll step out of the way. Big smile right down Dave's camera there, please, Chris.
Now, you think she's doing
an
nothing, Susie, but while
incredible
she's
difference.
sitting here, she's actually growing collagen. Because
Truly.
we've done one Fraxel laser on her already, and she will actually be growing collagen over the next 3 months. So we've got a series of other exciting things we're going to do with some of the
All
new technology
pain-free.
that's out.
Yes.
We have drugs. And so she's just going to look better and better over time. But it's all about collagen renewal now.
Sounds sensational. Nicole, thank you so much. Marty, you were very brave, very proud
Thank
of
you.
you
It was
indeed.
easy.
Chris, we are so enjoying your journey.
Thank you.
It's
So am
wonderful.
I.